Okay, it is 5:03, and I think we should begin. So we have our full hour, and I want to honor all of you who are very punctual, and thank you for coming to the next installment of From the Front Lines, a conversation about COVID. I'm Rabbi Jessica Zimmerman Graf. And I think this is one of the topics that we have all been thinking about since the beginning of this pandemic, or early on in the pandemic. We realized that this was going to be a crucial topic, figuring out how to address this topic and who in our community might be able to help us understand this from many different angles has been our work in putting this together. And I want to thank so much our panelists who are with us today. I'll introduce them in just a minute, but I want to tell you that we are calling this something like mental health and the effects of quarantine on our population. It's not the exact title, but we're going to talk today about the way that mental health has been impacted by this long isolation, shelter in place that we've all been experiencing. This installment, number 5 in our series so far, is a little bit different from the others in that we've decided to take a look at our population kind of from a psycho-spiritual aspect, to look at the way that community is important in addressing crisis, this pandemic. And this conversation, though it will be medical, is also about really at its core community and the emotional, psychological experience of this pandemic. So why are we having this conversation at a synagogue? Why are we having this conversation in a Jewish community? Well, the answer is that in our community, at Congregation Shereth Israel, and in the Jewish community, in the Reform movement in America today, we're asking life's big questions and trying to figure out together how to make meaning of what's happening in a complicated world around us. And so it makes perfect sense that we would gather as a Jewish community together to try and ask these questions and to see what the impact is on our spirituality, on our psychology, on our physical and mental health. We couldn't have a better panel of people here, and I want to thank them so much for being with us today. You'll have a chance to hear from 3 wonderful experts in the field of mental and physical health. First, Dr. Lauren Allerhand, who is a psychologist specializing in kids and teens at Stanford. She and her husband, Sean, joined our congregation just in the last year, and we're delighted to have them here and to have Lauren's expertise to really help us understand the impact on families and on children. We also have with us today Lee Pollak, who along with her husband Stuart has been a member of this congregation for decades and decades. I don't even know how many decades, many, many decades. Raising your families here. Lee has been an integral part. Many of you may know her from grief work in the San Francisco community. Lee has been a grief counselor and a therapist in the community for many, many years and helped to start the wonderful Grief and Growing weekend that continues to support mourners, people who are post-mourning through the Bay Area Jewish Healing Center. And together with Dr. Jim Davis, who is our 3rd panelist, who along with his wife Claire has been a member of our congregation for decades and decades. And I want to say Mazel Tov, they just welcomed a brand new granddaughter just a few days ago, and still you are with us here. So thank you for taking time away from the family to be with us. Dr. Davis has been a medical doctor in the community, helping with the adult population as an internist and rheumatologist. And we'll look at this to some degree from that perspective, from a medical perspective. But Jim and Lee together have been leading a group for Shereth Israel now for many months on issues of aging, looking at the way that Judaism and the medical community and the therapeutic community look at addressing many of the issues that come up as people age gracefully and with dignity and are living longer in our society. So thank you so much to all 3 of you for being with us. As always, to the folks who are out there, please feel free to ask questions in chat We will try to address as many questions as possible, but no guarantees because we have so many things that we want to talk about. I want to start today by asking all three of you a really broad question about your work. What population do you work with? What are some of the challenges you are seeing in this time of COVID? And let's start with Dr. Allerhand, looking at the way that children, teens, and families have been impacted by this pandemic.
Yeah, okay. Thanks, Rabbi Jessica. So like Rabbi Jessica said, my name is Lauren Allerhand, and I'm working at Stanford right now. I've worked with families kind of across the age range from very, very little to up through teenagers. And right now I'm focusing on working with kind of two separate populations, which is families with young children around the ages of 2 to 7, and then families with teenagers, so kids in middle school and high school. And I'm going to talk about the two separately since I'm noticing some different things in the two populations. So starting with the younger kids, we're seeing a lot more disruptive behavior and also some regression where maybe kids are doing things that they were doing when they were younger, that behaviors that had stopped but are kind of cropping up again. And, you know, I've been counseling parents around this, that when kids are younger, they don't necessarily have the words to say, you know, I'm very worried, or I don't understand why I'm not going to school anymore, or why are mom and dad not going to work? Why are we having to wear masks outside? So since kids aren't always able to express their anxieties or their worries like adults do, some of these things come out in behaviors. So I've been working a lot with parents around understanding, you know, what this might be like from the perspective of a 2-year-old, what it might be like from the perspective of a 6 or a 7-year-old, and then helping parents to have conversations with their kids about what's going on in the world in a way that's going to continue to make them feel kind of safe and protected and understand a little bit of, you know, what's going on. I think a myth that some parents believe, or that some people believe, is that, you know, kids don't understand what's going on or don't have a sense of what's going on. And I've been really counseling parents that, you know, generally that's not the case, that the kids know that something is up, they know that something's wrong, and not addressing it head on allows them to, you know, come up with their own ideas about what's going on. And with a, you know, a 3 or a 4-year-old brain, that idea might be a little bit farther away from the truth than we want it to be. So with the families with younger kids, I've been really counseling them to talk with their kids, answer questions to the best of their ability, and understand that if they're seeing flare-ups of behavior that maybe they haven't seen in a while, that likely it's an expression of anxiety or stress just related to this whole shelter in place situation that we're in. And, you know, also doing a lot of validation for the parents and recognizing that now is a time to do what works and kind of get through this experience, and, you know, making sure that they're taking a little bit of time for themselves, just because, you know, 24/7 parenting a young child is an extremely tiring activity, as I'm sure Rabbi Jessica can attest to. So that's kind of what I've been thinking in regards to the younger population. And the other group of patients that I work with is teenagers and the parents of teenagers. And it's mostly teenagers with depression. And this situation of sheltering in place is just about as terrible an environment you can have for somebody who's susceptible to depression as exists. Typically, when we treat depression, some of the recommendations that we make are make sure that you have a lot of structure in your day. Make sure that you're getting out and spending time with people and doing activities. Make sure that you're interacting with other people. All of the things that you're not supposed to do because of COVID are, you know, the things that tend to increase depression in people. So for a lot of these teenagers, the environmental factors that are related to sheltering in place and needing to stay isolated is leading to worsening depression. So part of what I'm doing with them is trying to explain some of this information, and, you know, if they were on a trajectory where they were getting better and that has stalled or they're starting to get worse, trying to remind them that some of this is out of their control, and, you know, trying to help them remember that they're doing the best that they can given the circumstances, and the circumstances are probably making it much more challenging for them to progress or for them to, you know, continue getting benefits from treatment or seeing a lot of change. So that's kind of one circumstance that I'm seeing, is kids whose depression and kind of symptoms are getting worse because they're not allowed to be in their natural environments, which is school, which is spending time with friends. So for some of these kids, it's getting a lot worse. And then there's another subset of kids who, some of what causes them distress is their environment. So like lots of negative interactions with peers, or lots of challenges with school. And some of these kids actually have gotten a little bit better during quarantine. Some of these kids, they feel like they're out of the environment that causes them a lot of stress, so that right now they're kind of doing a little bit better. And while that's great in the short term, and I'm happy that they're, not facing as many challenges as they were maybe a few months ago, I'm also worried about them for when we return back to more of what we were doing before shelter in place. So there's a kind of a second subset of people that I'm working with where they're doing a little bit better right now, but the challenges of reintegration and of going back to school and of kind of getting back to the routine, I think is going to be significant. So those are kind of some of the things that I've been seeing, and really across the board, trying to support parents, validate how challenging their job is right now, and reminding them that what works best for their family might not be what they're seeing on social media, might not be what their parental friends are doing. So I think that I've been noticing that a lot of parents are getting quite judgmental of what they're doing, and is it enough, or do I have enough structure for my child, or do I need to be planning more activities? Is it okay if I give them more screen time? A lot of these questions have been coming up, and I think some of that is comparing to what they see other parents doing on social media, or what they're reading about other parents doing. And given how challenging this situation is for everybody, I'm really trying to help parents recognize that what works for their family might be different than what works for another family. And there's not necessarily one right way to kind of make it through this process. Okay.
Thank you for that really wonderful introduction. I have so many questions to ask you, but I'm going to save them until we really get a chance to hear a little bit about the full age spectrum. That was a fantastic introduction to young people up through, into young adulthood, let's say, and kind of the family structure. Thank you so much. Will you tell us what you're seeing?
So some of what I'm seeing, honestly, is also the same things that Lauren identified, and they overlap. Obviously, all the ages overlap to some extent. My own work is primarily with adults, and primarily in the area that I've very long practiced, which is the area of grief, loss, and mourning. This is it's less spoken about in a sense, because we're full of distractions of just getting through our days. But it's a very pervasive psychological response to quarantining and to the COVID crisis. And it's what I really want to focus on this evening. I learned a long time ago in my work and also in my personal life that grief and mourning are inevitable responses to not only loss from death, but to all sorts of less visible issues and to all sorts of transitional moments in our lives. We do a deep dive into this in the group that Dr. Davis and I co-facilitate at Cherith Israel with older adults. Many of you may know Elizabeth Kubler-Ross's work. She's somebody who created a system of grief responses to loss. And one of the things she said that I always found interesting is that even when you lose your keys, you go through a grief response. Hopefully you find your keys again, and your grief response is not as intense as when you lose someone to death, for instance. But it reinforces what I'm seeing now in the people I'm working with and in the area around me, which is that people are grieving. People are grieving because we are experiencing not only feelings of anxiety and isolation and frustration and depression into all the things that COVID entails, but what accompanies it all is this pervasive grief that I think underlies a lot of what we're living with. Some of us are facing, of course, the very difficult grief from the deaths of people we know and care about. But we understand and acknowledge that grief, even though it's hard to support people in the same ways now that we're sheltering in place. But that's recognized and it's accepted and it's understood. But what I'm seeing is that we're inevitably facing other losses too. Losses of plans, expectations, things that we thought about our future, the patterns and structures of our daily lives, life as we knew it before and as we lived it. That's all changed now for all of us. And particularly, I think, as for we older adults, we know we're not going to get these years back. We know these times are really critical for us, and we're not going to be getting them back. So yes, we're facing a lot of loss. There's a name for it in professional grief care, and it's called a disenfranchised loss, which means that it's a kind of loss, not from death, but a loss that is very, very, that impacts on us deeply and psychologically, but that is not always recognized. We may not be talking to people about the difficulties we're having in knowing that the plans we had for these days cannot come to fruition. The expectations we had, we can't follow through on that. We don't have control over things like that. And of course, we're all distracted, particularly the adults, I think, at this point, caught up in trying to adjust, to stay safe, to stay healthy, to keep our homes clean, ourselves fed, all the things that we're doing now that are major distractions in our lives. But I think that underneath it all is a pervasive sadness, really an acknowledgement that we're grieving, we're mourning. We have things that we thought we would be doing at this time, no matter what our age, that we can't do. We're 4 months into this really turbulent crisis, and it's been a long 4 months, I think we'll all admit. And we're facing this in quarantine, in somewhat of an isolation. Even those of us who are living with people, we're somewhat isolated from our normal communities of support. But we're facing it with the global issues of our times, the politics, the climate change, the social injustice. Nearly all the pillars, as I began to think about this, I realized that nearly all the pillars of our individual lives have been shaken during quarantine, during the COVID crisis. And it's major, and it's overwhelming. So yes, my field of grief care seems very pertinent right now. It focuses me on the reality that people are mourning and that people are grieving. It underlines for me, honestly, personally and professionally, how important it is to understand that and to acknowledge it and to pause in our lives, not only with the forced pause that quarantining is forcing on us, but also with the pause to really reflect, to give our attention and intention to the grief that is underlying some of our feelings. And to do this in order to find the energy and creativity that we're going to need to face whatever comes next, hopefully new beginnings. We need to complete the endings that we're dwelling in right now. So I have a lot more to say and a lot more to think about, but basically that's kind of my overview of what an underlying condition is that we may not be talking about as much as we're talking about some of the other things.
Thank you so much, Lee. I think you just gave us a context in which we can understand so many of the feelings that we've had as we've been struggling through these months, but not necessarily able to put words to the kind of overwhelming sense of loss and sadness that you mentioned. And I have many questions for you too, but I would like Dr. Jim Davis to add to this very rich conversation that's beginning here. Please tell us what you've seen in your work and how this is impacting people physically and emotionally.
Yeah.
Wait, you're muted.
You're muted, Jim.
There we go. Now you can hear me, I take it? Can you hear me?
Yes.
Great. I'd like to start by just thanking the group that we've been meeting with since January, before the pandemic started. And what we as a group together have been exploring is how we made the choices that shaped this chapter in our life. You know, these choices at that time were largely based on the wisdom that we had gained from our past experiences, our families, and how we dealt with the previous crisis that we were confronted with. All of this in an effort, during this chapter in our lives to find meaning, contentment in our meaning and contentment in our lives, to be valued, to be respected, and also to experience emotional intimacy, which is very important. Then we were hit with the COVID pandemic about halfway into our discussions, which was not our choice. I mean, before we had a choice, now we had no choice in this. And it was sort of uncharted territory, which has added an additional layer of uncertainty to all the issues with which we're confronted. And the social isolation, it has led to a sense of loneliness. I mean, you can be socially isolated, and that is a contributing factor, but you can be lonely in a crowd, but certainly this increased isolation has exacerbated that. And when we feel lonely and feel anxious, what do? We turn outward to the media and to the social, the social networks we have that help support us. And the problem that's happened is they've become unreliable. Back when we were really young, we had Walter Cronkite, we had a 24-hour news cycle, and we could depend on what we were hearing. And now we really don't have a reliable source of information. As a physician, I would turn to the CDC, especially when I had an epidemiological problem, and I'd take what they had to say and just run with it because I trusted it. And even, the leaders in the medical world have uncertainty. There was a very interesting editorial in the New England Journal of Medicine, which is sort of one of the premier medical journals in mid-May, where the editors said, where do you get your information? And they said, we don't know. I mean, we don't have a reliable source. And as Lee said, there would always be a pause. People would do their research, they'd submit it. It would then be submitted to a group of experts in the area who would read it and make recommendations, whether it should be published or amended or whatever. And then that would happen. And now what happens is it's just put out there without being reviewed in a meaningful way. Maybe it's placed on Twitter first, but it turns out to be unreliable. And I think an example of this is what happened with hydroxychloroquine. Initially, it was advocated as being effective, and then further studies showed that it wasn't effective and it might increase the risk of cardiovascular disease. And then just this last week, there was another article that came out, which was actually peer-reviewed from Henry Ford Hospital, where they looked at 2,500 patients that were hospitalized, and the people that took hydroxychloroquine had a 50% decrease in their mortality rate. And that was from 26% to 13%. So what happens with all this uncertainty that's racing around us, it makes us sort of, depend on our own intuition, to develop our own personal narrative. And that tends to be more self-centered. And we tend to sort of, lose the idea of what's really going on in terms of the larger community and what's better for the community need. And I think that, face masks and the need to wear those really, typifies this. So that, it doesn't really protect us as an individual that much, but it really protects the common good. And, so I think that when I look at this controversy sort of with, I look at it, is that what, that surrounds the use of masks, I think it's just another example of our need to restore, the moral fiber that binds all of us together that's been so evident in so many things that we're facing at this point in time. So.
Thank you so much for the introduction, and also both to you, Jim and Lee, for the ongoing class that you've been teaching, allowing these issues of aging and this conversation about putting it in a Jewish context to really be central to Sheretz Israel's time. It unfortunately happened that it coincided with this pandemic that we couldn't have predicted, but all the more important the opportunity to have that as an ongoing conversation. So I want to ask all three of you, Greg Tolson asked a question here in the chat that I want to broaden a little bit and ask about the role of grandparents and what that means, what the possibilities are sort of from all of your perspectives. What does it mean to be an older person who, as you said, Lee, feels like you won't get this time back, and there's the frustration and fear of what can my role be as a grandparent? Jim, what do you feel are sort of the realities of the safety precautions that grandparents might need to take, and how does that impact on the emotional role as a brand new grandpa again, on the emotional role of grandparents? And Lauren, from your perspective too, what is the possible role of grandparents? How do you keep kids away from grandparents? What does that do to kids and grandparents? And what's the benefit of families being able to be together in some way? Some grandparents are remote. What do we do? Grandparents ? What do we do? Where should we start? Lee has a hand up, please.
Okay. Well, being a grandparent of 6 grandchildren, I can say that one thing that we miss out on is, the cuddling, the being able to be in contact with them. And for those grandparents who don't even live near their grandchildren, they're not able to see them. It's just not the same. And as I'm sure Lauren can attest to, the relationships are very different according to what ages they are. I can have some very wonderful conversations with my older grandchildren, but with the younger ones, with babies, it would be harder. I don't have babies at this moment. But I will say that one of the tasks, and I just want to briefly mention it, of older age, and we've done a lot of talking about this in the group that Jim and I facilitate, is one of the psychological tasks of older age is to develop insight, to develop wisdom, to reflect and to review our lives. And part of the joy of doing that is to be able to share it with those that are younger in our lives. And we're having to do that in very, different ways and artificial ways right now. So I won't say any more. I'm sure that Jim and Lauren have things to say, but I think that it's definitely impacted on the relationships with grandchildren in a way that makes it much more challenging and much more difficult. I will say also, though, that the relationship with our children, with our adult children, I think is changing perhaps in more positive ways, where we older people are learning to rely on that generation more. My children have been bringing me food and things of that nature, and it's shifted our relationship in a different way.
Wow, very interesting. Thank you. Lauren, please.
Yeah. So I just wanted to start by kind of commenting on what you said, Lee, and I really appreciate that you noticed a positive, because I think that, in all of these questions, there are a lot of challenges and a lot of negatives, and then there are some positives. And, we've talked a lot about isolation and feeling isolated from people based on shelter in place. And I think that while that's true for the most part, I personally feel like I've been talking maybe on the phone or on FaceTime to people a lot more than I was, before shelter in place. And I like that you pointed out that there is, some benefit to some of our relationships in this circumstance. Speaking specifically to grandparents and what you can do, I'm not going to make any recommendations about seeing people, because that's just not my area of expertise. You should listen to your medical doctors and to what what you feel comfortable with and what your family feels comfortable with based on where you live. So what I'm thinking about is, how can you be involved maybe over a computer or over a safe distance? So, Stanford is doing this thing that I think is really cool. We have some medical assistants who are engaging with professors' children for like an hour or two to give them time to complete paperwork. So the MAs call, the parents have to be in the background, but the MAs call and play a game with the children over the computer for an hour. And, to me, that seems like if, figuring out Zoom or Skype is a possibility, setting up an hour where you're going to play a game over the computer with your grandkid. I think it has the benefit of you guys getting some one-on-one time, of them getting an opportunity to socialize with people other than their parents and their immediate family. And it might give the parents like an hour break where they can catch up on their emails, or they can, just maybe sit and read a book and just listen to make sure that things are going okay and everybody's kind of doing all right. But setting up time to maybe play a game with the kids over the computer, FaceTime with them, ask the parents, parents might also know a little bit more, maybe you can, you know, get creative and you can read them a good night story over Zoom or something like that. Parents will probably have a sense of times of the day that they could really use 20 minutes on their own or 15 minutes. And that seems like a great time for grandparents to, you know, be semi-supervising over the computer with parents somewhere, not for the young ones, the parents not too far off in the background in case you hear the computer drop off the desk or something like that.
Well, two things to build on that. I mean, one of the things in our own family that's been nice is every Friday night we would get together with just the kids that were here in San Francisco. And when we stopped being able to do that, we now incorporate our kids back in DC. So it's, you know, telemedicine has actually been a bonus in terms of, you know, opening up the horizons for what we can do. But I think that personally, I think that the big issue for me has been balancing the need for safety, you know, with the need to be able to embrace my grandchildren and have our family together. I mean, as you get older, your kids become very concerned with your safety. They don't want you to get sick because we're at more risk. And so they sort of focus on that and in some way defocus on, you know, the need for intimacy that's so important to us. I mean, it's important to teenagers, it's important at all ages in life, but as you get older, you really want to still be meaningful, to have value, to be, you know, to be respected. It's really very, very important to have that meaning in your life. So I see that as an issue.
Great. Lindsay asked a question in the chat that I'll read. It says, are you seeing depression crop up in teenagers without a history of depression? And I want to expand her question a little bit to ask all three of you if some of the symptoms of this time that you're seeing in your population are things that feel like they'll be permanent. Are they, you know, how will they go away? Is there sort of a magic, you know, as soon as the stores open up and there's a vaccine and everything's fine, will all of this sense of isolation that we've been talking about, or a sense of distance, or even some of the positives, you know, will we go back to normal and then not see that there's been a permanent change? Or are you sort of seeing, you know, are some of these symptoms really just temporary? To Lindsay's question, is it, you know, there was nothing preceding this and maybe nothing after? Is this a temporary situation? Lauren, you're shaking your head.
Okay. I'll go first. I guess my first thought to that is like, change is the only constant in this world. And, you know, all of our history and everything that's happened to us impacts who we are, how we think about ourselves, how we think about the world, how we interact with other people. And, you know, while I am very much looking forward to the time when I can see more people and, you know, go back to maybe what was normal before, you know, I think that this experience is going to impact everybody in some way or another going forward. I think that none of us are going to be the person that we were before this started. And I don't think that's necessarily a bad thing. I think that, you know, there are going to be some lasting effects of anxiety and depression based on what this, you know, this experience. I think especially anxiety around seeing people, around going out, you know, thinking especially of younger kids. You know, when you're in the 2 to 6 range, that's a really critical time to learn a lot of social skills. And it's not saying that kids who are that age will not have that opportunity or they're not doing Zoom camps, but it's an important time to learn social skills. So, you know, there's definitely going to be an impact on people across the age range. And to speak to like seeing depression in people who haven't seen it before, I think with kids, the ages when these things develop is kind of early, you know, 8, 9, 10, up through the teenage years. So even if it's not something that you've seen before, we tend to think about things as like, there's always this interaction between like a biological predisposition. Do other people in your family have depression? You know, is it something that runs in your family? And then environment. And there's always a little bit of both. And sometimes there's more of one or more of the other. And right now we're in a moment where the environment is really conducive to causing a lot of distress and anxiety and depression. So people might develop what looks like depression. And if there isn't like a strong biological predisposition, maybe it will go, kind of some of those symptoms will go away as the environment opens up and as the environment stops putting a lot of pressure on them. And at the same time, it's hard to say, because I do think that there will be some stress with just reopening and kind of going back to environments where there are lots of people, which we haven't done in a long time, or just getting back to what a routine was like before. And there may be some other lasting effects.
Before Lee and Jim answer, I just want to ask you, Lauren, kind of a follow-up question to that, because there's been a lot of concern among parents with kids the age of our kids, 4 and 5, really little ones. Will they be able to catch up? Sort of what do psychologists feel will be the long-term detriment? Are my kids ever going to be civilized? Will they ever learn?
No, get rid of it now. So it's definitely not all doom and gloom. Children's brains are incredibly plastic. You know how kids learn languages faster than adults ever can? It's because their brains are in this period where they can take in a ton of information, integrate it, get rid of what they don't need. And, this, I would say, is not my area of expertise. At the same time, I feel confident that, most of human development, there's this idea of like a critical period, where like, it's a time period where we want something to happen, but it's not very short. It's like they have a few years to learn these skills. It's not like if by this age you haven't done this, then you're going to have a lot of trouble. It's mostly they have a period where we want this to happen. So, they'll go back to school and I hope that they'll all kind of make it up. And you have to remember too, that most kids are experiencing this. So what my hope is, and I don't know, because I don't know how the schools are going to function, but if I was running a school, I would assume that everything that happened after about like March is lost, and that every kid is going to need a lot of catch up. So I would assume that, if a kid is going into 4th grade, hopefully the first few months are going to kind of look like the end of 3rd grade, because we're just going to assume that the homeschooling was kind of a wash. So I imagine that there's going to be a lot of catch up next year, because all kids are in this boat. It's not like just your child is kind of behind. All kids are, going to be behind of where we might expect them to be.
Good. There's hope.
There's definitely hope.
Lee and Jim, the same question to you. Are you seeing depression crop up in adults and older adults without a history of depression?
Well, it clearly exists. I mean, what happens, what's been exacerbated, with the social isolation is really loneliness. And, loneliness is, it's associated with obviously stress and anxiety, but also there's been, well-documented studies that have shown there's a 50% increase in the incidence of heart disease, of cancer, of dementia, of premature death, of exacerbation of diabetes. So, social, loneliness is really not a benign, thing. So, it's, those people don't have a history. About 40% of people are lonely, pre-existing. But there was a study that was done by UCSF looking at after the COVID, experience just last month. They looked at 140 adults, and 40% of them were now where they were, have increased feelings of anxiety and loneliness that they didn't experience before. So clearly you could have pre-existing doing well, but you're certainly at increased risk for these feelings if you do have pre-existing depression and other feelings of isolation.
And I would add to what both Lauren and Jim have said, really, I agree with everything you're saying. I'm also seeing another side of it, which I think is really the positive side of it, which is that people are learning and trying out new tools for dealing with their moods and anxieties and frustrations. And yes, a lot of it's exaggerated because we're sheltering in place and we're quarantined. But this pause is also giving people time to try new things. One of the new things that I've been seeing people work on is a practice of positive psychology. And we all know, remember that song from King and I, whistle while you work, or whistle, yeah, a happy tune, I guess it is. And positive psychology research has recently shown that if people even pretend that they're feeling good, if they smile, if they identify the positive things in their lives, that they will inevitably feel better. And I think people are trying that. I think people are trying all sorts of things. We have this pause in our lives and activities. And one of the really good things about it, I think, is that we can try other things. I know some people that I'm working with are trying meditation for the first time, and they're finding that that's really useful. There's a lot of, I think, I guess I agree with Lauren. I think everything changes. It's not going to stay the same. I know that for sure. But what I hope is that it won't all go back to the way it was. I don't think it will. I don't think it can. But I think that we can learn new tools and new ways of approaching life and some of the issues that we're dealing with, and appreciating some of the things that perhaps we took for granted before that can make us feel better.
I love that. I think people have been creative in so many different ways. You know, people are baking, right? I finally made an edible challah. All of you have been.
Well, I have to just say that my husband is sitting in the background, and he just mentioned use of the computer. It's absolutely true. I have learned far more technology than I knew 3 months ago.
Yeah, and I think people are trying out all kinds of things that they hadn't done before. So I definitely think that it's important to remain hopeful and to see the opportunities that come out of this time as well for us to engage differently. As you mentioned, the use of the computer. So I wanted to ask, Lauren touched on it a little bit about the way that grandparents or family that's distant might be able to engage with children or read a story. What are you seeing as far as the use of Zoom from kind of a medical or therapeutic perspective? Can you have good meetings with people? Can you, evaluate or examine a patient over Zoom? Can you have really meaningful conversations that are as helpful and meaningful as they would be in person, or are they more meaningful?
Well, from a senior point of view, telemedicine has actually been shown to be very effective. There have been a number of studies that have shown that it's almost as good as, an in-face interaction, and especially in dealing with people with dementia, if they can do that. What you need is someone like Peter Bonos. You need an IT person there that makes people feel comfortable, because a lot of seniors feel very challenged, as was already alluded to, by the computer. But telemedicine does work. But there's the unintended consequences of that, coupled with this whole technology thing that's entering homes, that we have to balance that with the think of healing touch, that we're losing the actual dimension of the in-face personal interaction. So you can get a lot of that with telemedicine, but it's certainly challenging.
And one of the things I want to add to that is that I'm clinical director of our Grief and Growing retreat program that some of you know about, that we do annually as a residential grief care program. And that particular program, we're really trying to not put it online, because it won't go online. We can't really put a residential program online, but we're trying to recreate it, to take the core pieces of it and see if we can find a way to virtually provide some of the intimacy and support and connection that people really benefit from when they come to this grief program. And it's complicated. It's very difficult. I hope we can accomplish it, but we're working hard on it.
Yeah, I agree with kind of everything that's been said so far, and like just about everything that we've talked about, there are positives and negatives to this. We're able to have some people in our treatment program who live farther away right now than they would want to commute to Palo Alto twice a week. So we're having some families who can be a part of our program that probably wouldn't be able to be a part of our program if they had to fight traffic. At the same time, like Jim said, there is some part of the human connection that isn't quite the same over telehealth. What I have actually found really interesting is I didn't realize how important that was to me, and how much that, helped kind of nourish me in my job as a therapist, because I've actually found that I don't like the telemedicine as much because I don't feel as connected to my patients, and that's a really, I think, important part of what keeps me going in my job. So I've noticed that, on the provider side, because I'm used to the in-person, in some ways it doesn't feel as connected. At the same time, I think I've still had lots of really good sessions with patients, got into lots of interesting areas. And, for the teenagers who I think spend a lot of time on their phone anyway, as I'm sure anyone who interacts with a teenager has seen, I think that the transition for them was a little bit more seamless, that they were a little bit easier to kind of transition in. They were comfortable with the technology. Yeah.
So tying that into what the rabbi was saying earlier, is that telehealth is going to be with us. This is going to be one of the last, sequelae of this pandemic. It was brewing before, but now over 3 months, we've instituted this whole new way of interacting with people, which has the pluses of being able to bring people in from far distances. But we're going to have, it's becoming a reality, and we're going to, with time, learn the unintended consequences of it.
Mm-hmm.
I want to ask you about conflict in the lives of the different populations that we're talking about. Are you seeing increased conflict in the lives of your patients at home or in other places? Has conflict come up as an issue?
I'll talk about with the people that I work with older adults and with adults. I'm really not seeing that so much. What I'm seeing more is an appreciation of the fact that they are there. Now and certainly sheltering solo brings up all kinds of different issues of isolation, and that, that wouldn't lead, that we can certainly acknowledge that happens. But when people live together, couples, families, partners, roommates, there can definitely be increased tension in the interpersonal relationships. Little issues become big issues, and little tensions become big tensions. So that's certainly possible. But I also think that the emotional roller coaster that people are living with, that people are learning to adapt to that. I am not seeing the amount of conflict and tension that I would have thought would be occurring as people are living in such close quarters. I think there's an overall sense that we're all in this together, and maybe even a greater sensitivity to being compassionate and kind to others as well as to ourselves.
Wow, that would be a fantastic outcome, a really wonderful silver lining. There was an article in the New Yorker magazine at the very beginning of the pandemic predicting lots of divorces.
I know.
And you can imagine, why that prediction would be made, right? When people are kind of stuck together for a long period of time, there are sometimes problems. And of course, there was just an article that came out about a problem that we know to be true, which is for people who are unsafe in their homes, not being able to get out of their homes. Or, I imagine, Lauren, that you see this also with children who are in an unsafe environment and not having the safety and the outlet of a school or of friends' houses or other places to go. So I'm glad, Lee, that in your work you're seeing a lot of kindness and a lot of feeling of empathy and of sheltering kind of together in a larger social way. Kind of an understanding.
And maybe that's because I'm dealing more with older adults who don't have the tensions of time constraints of having to take care of children and feed children and be on those different schedules. I mean, in some ways they're more relaxed.
By and large, we lost our job long before the pandemic started.
Right.
Jim or Lauren, what are you seeing?
Yeah, I can speak next. So, first I want to speak just a second to what you said, Rabbi, about, children who are unsafe. And in an article I read recently was that child abuse reports are down, but that's actually not reflective of, any change in the pattern of behavior or in the amount of, unfortunate child abuse that's occurring. It's just the fact that kids are not at school and they're not in the places where people who make those reports and who tell officials about that sort of behavior are getting to interact with kids. So, I think that that's right, that people who are vulnerable continue to be vulnerable with, unfortunate, less outlets for them to get help sometimes from people who might see them and be able to help. So, and I think too, unfortunately, that level of conflict and, child abuse and some of these other stressors, I think there's also a strong correlation to space and to socioeconomic status. So on a much smaller level. My husband and I, Sean, about 3 weeks ago, we moved from a junior 1-bedroom apartment to an apartment that's maybe 2 or 3 times the size. And I've noticed that it's been great for our relationship to have a lot more space. And I think that's true for people across the board, people in smaller, more confined quarters. I think that it's much, much more challenging to keep conflict low if people are, in very confined spaces. In terms of conflict, something that's been coming up a lot, and I think especially now that summer has hit, has been, teenagers wanting to do more and families trying to kind of find a middle path between giving the teenagers the ability to see some friends and then making sure that they're keeping their family safe. And, what I've been reminding a lot of parents is that with teenagers, with the stage of brain development that they're at, it's actually very challenging for some of them to really think about the greater community and think about how their actions impact others. It's a skill that they're learning that parents, it's definitely an amazing time to model it for them, but they're very strong and sometimes like very strongly express desire to see their friends and, do what they want and be a little bit maybe self-centered is actually a common part of is kind of consistent with the stage of development that they're in as teenagers, is they're not as good as, adults in being conscientious and being able to think about, if I go see my friend, what does that mean for grandma? Or if I go see my friend, what does that mean? What kind of example am I setting? So that those are skills that they're learning. And this is a great opportunity to teach them that sort of thing, but it doesn't exactly come naturally to them.
Nice. Jim, did you want to add anything to that?
I would just echo what they had to say. The only, so it's just that, I would say really echo my experience has been exactly that with which that Lee's had. But my only concern is that there's not the, in terms of space, that people don't have the space to report, that they've been abused. I mean, there's no privacy that they can go. Their husband or their spouse or their partner not going off to work, so they don't have that time where they can reach out and get help. And that's my fear.
Mm-hmm. I want to ask each of you to kind of summarize what you think are the main things that you want people to be aware of along the lines of this topic of mental health and COVID, what you think is the most important takeaway. We could talk for hours. I think this is a central topic as we've tried to discover the way that we can kind of stay healthy, both physically, but also mentally, emotionally, spiritually, in all these ways. What is your takeaway from your experiences over the last few months in your area of expertise? Jim, let's start with you. We'll go the opposite, if that's okay.
Well, I think a lot of what I feel has already been stated. I mean, there's a lot of positivity that's come out of it. It's helped me focus on, you talked about grandchildren, just spending time with my granddaughter in our backyard and having increased time on Zoom with my kids back east. So, it has helped me, focus on, my core values and my family. And that's really, been wonderful. It's also, giving a shout out to the synagogue. I mean, I think that there's, people want to feel engaged. And I think that there's things that are available to us that we now are taking advantage of that we didn't previously take advantage of that can really be of great assistance. So, I'm very optimistic about the future, but I think we have a long road that'll be filled with a lot of uncertainty to get there.
Yes, you can come to the synagogue and not have to park. It's awesome. No, but I think, you raise a really important issue of kind of with the distractions being gone, of being stripped down to really our core values and asking ourselves, what are those? And having an opportunity now that we don't always have to answer that question. Thank you so much. Lee, will you give us kind of a summary of your thoughts?
Well, I want to really mention a saying that I often use that I really like. I think it's a Buddhist saying, but it states that life is not always fair. Anyone who knows me has heard me say this before. Life is not always right. It's certainly not always what we expect or want or even deserve, but it is what is. And that's what I'm really feeling now. We have to deal with what is. And what is are all the things that we've been talking about this evening, and then, of course, more some. It's a world that's kind of turned upside down. So yes, we're all looking for different kinds of resources. I do believe that Cherith Israel has a lot of resources that people can use and can take advantage of. And, you know, one of which is a panel like this, but all of the programs that go on there also, to keep us from feeling isolated and alone, and that we're in it alone. I mean, we are really all in this together. And I think that as we shelter in place and as we deal with quarantine, that it's not what we wanted or wished for, and certainly not what we expected. But I think that psychologically and emotionally, we need to allow ourselves to mourn and to grieve that this is not what we wanted, not what we expected, and it's very different. But also to find the energy. If we get through the sadness and we acknowledge all of that, I think we can also remember that we are all in this together, and that's incredibly validating. And maybe that's the most comforting thing we have, that it is validating. We are in this together. We are not alone.
And also very valuable once this is over, if we can use that sense of connectedness and common experience to help us move forward and build a new society, a better one. Thank you. Lauren?
That was very beautiful, Lee. Thank you. And I'm also going to go with a little bit more of a Buddhist ending as well. One of the core ideas in the therapy that I do primarily is that everybody is doing the best that they can with their current set of skills. And it's really, I want everybody to remember that this is we are in an interesting new environment where not a lot of us have had this experience before. So be kind to yourself. Know that you're doing the best that you can. If you could do better, you would. You have the skills that you have, and that doesn't mean that you can't learn new things and try out some of the new ways of coping that we talked about a little bit. And there's room to improve. But I think my message would be, be kind to yourself. Acknowledge what you're feeling and recognize that it's okay, and validate yourself that however you're feeling right now is how you're feeling. There's a lot going on, and there's a lot of feelings that can be kind of going on with it. So, be kind to yourself. And yes, that would be my message.
I love these Buddhist teachings, and I want to just give us a couple of Jewish ones to close, because we are having this conversation in the context of a Jewish community, and of course, learning from our neighbors and their best values and teachings is a wonderful thing that we get to do in America, where we all learn from each other. But I want to say that I think the Jewish community in some ways is uniquely maybe like other immigrant communities here, kind of uniquely poised in some ways to address these challenges that we're encountering now. We're a community that throughout history and across the world has been forced to pivot, to start over again, to reimagine ourselves and our environment. And I think those skills that have kept the Jewish people strong and alive and nimble over millennia serve us well now as we kind of rethink what our society might look like, ways to improve ourselves and to address the challenges, both acknowledging our sadness, our grief, our loss at this time, and also the incredible opportunity that you've all talked about that's provided here that gives us a new opportunity to focus on our values. I think Judaism throughout history has sort of taught the world the best ways to do that. When the temples were destroyed, when we went into exile, we've had to recreate ourselves. And I think that the message of Judaism of acknowledging sadness and of letting that in and of sitting with that as we do on Tisha B'Av is very important, while also moving out of a state of mourning or sadness and into a place of hope, as our people has always throughout history. I was thinking of Tisha B'Av and kind of the day of commemoration of sadness, and we end with the words Nachamu, Nachamu Ami, be comforted, my people, because out of this will come something that will grow, that will be a beautiful next chapter in some way. I want to acknowledge also the community, and I think what all three of you have talked about is a sense of support that comes from community, whether you're sheltering in place solo, as Lee said, which comes with its own challenges, or sheltering in place with toddlers, which comes with its own challenges. We find ourselves being able to connect and to rely really on each other. And one of the things that's been most beautiful, I think, at Congregation Shereth Israel is seeing the way that our community has remained vibrant, even in some ways more vibrant, in terms of being in touch with each other, in terms of finding ways to connect throughout the week and not having to park. I'm only half kidding, because nobody likes that part of coming together. But a real sense of linking the generations, as you all talked about in different ways, of finding wisdom from older people, from younger people, the joy in sharing those moments. Lee, as you said, of as an older adult, sharing that joy with younger people. And I think the reverse is true also, as a young person being able to express joy to the generations above, being able to show something that was learned or a new skill, or really gives a sense of confidence and a sense of deep belonging, and of being able to celebrate even in this time of some confusion, when, Lauren, as you said, children don't necessarily have the vocabulary. I mean, adults don't necessarily have the vocabulary either to ask all of the questions now. But I was reminded of this morning when our 4-year-old asked if he could have a peanut butter sandwich for camp. And I said, no, Zach, you can't have a peanut butter sandwich for camp. And of course, that's because it's a nut and peanut-free environment. But I didn't say that. He turned to me and said, but Mommy, why can't I have peanut butter during the virus? And I realized that, his questioning is trying constantly to understand, even in cute or really little ways, what is it that's changed in my life, or that's changed in my environment, or how is that different, or how do we stay safe? Because we talk about keeping distance, or certain things that we can or can't do now during this pandemic time. And so they're kind of, in a way, reflecting back how we're all reevaluating our lives. And the last thing I want to say, really, in terms of a Jewish value, I mean, we've talked a lot about pikuach nefesh and saving lives. Of course, that's the overarching value that guides us in all of the choices that we make, like coming together right now from a distance and not being physically proximate, which I wish we could do in our beautiful sanctuary and our beautiful building that we love so much. But really, our community is alive and vibrant. From a distance, we talk a lot about Kol Yisrael Aravim Zeh Bazeh. Each person in our community is responsible for taking care of each other person. And we support each other and ensure the safety and the ability to go on living. It's a value that the IDF holds at its core. Each person is responsible for taking care of each soldier for every other soldier. And in that way, we too, as soldiers in life, as people who are traveling through life together, we take care of one another. So I want to encourage people to continue doing what you've all been doing so well. Check in with other people, continue to take good care of yourself physically, and give yourself a break, as Dr. Allerhand has been saying, validating, what we're feeling, and a sense of doing the best that we can do. I think Dr. Davis has told us also the physical ramifications of the emotional experience of this are really enormous, and we have to take very good care of ourselves and to reach out to these incredible professionals, so many people out there in our world, immediate and not so immediate, who really have expertise in these areas and can help us. There's a lot of help out there and help through the community. So I want to thank the three of you so much for being with us. Dr. Davis, Dr. Allerhand, Lee Pollak has just an incredible group of the three of you who bring different wisdom and such wisdom to our community every day, and particularly today. So thank you. I want to also announce two really exciting upcoming programs. One hot off the press. Nobody has heard this yet. So you're all the first to hear this. On Wednesday, July 22nd, and I want to apologize publicly, Lee and Jim, that it is on the same day as your next group. I know that, but as I finish my sentence, I hope that you will forgive me. We will be talking with Mayor London Breed, who gave us that time as a time that she was willing to talk with us. So please excuse me for conflicting with your class. She will be with us to talk about COVID, racial justice, San Francisco, and what kind of our landscape looks like as we navigate all of these complicated issues. So please save Wednesday, July 22nd at 5 o'clock. More information, of course, will be coming. The following Wednesday, July 29th, Dr. Jeremy Faust will be back with us talking to Dr. Jonathan Graf about the epidemiology, what he's seeing as this pandemic continues to progress, confuse, exasperate, frustrate, and all those other words, all of us across the country. What does this look like? He was, of course, our second guest. And by the way, all 5 of these sessions have been recorded and will be posted, or are posted, except for today yet, on our website and on our YouTube channel. For anyone that you would like to share these with, please do. If you'd like to go back and listen to any of the conversations that we've had with our experts in the field, please feel free to listen again and to share these. So lots of interesting things happening and coming up. Thank you, thank you, thank you to the 3 of you for sharing your wisdom with us, and to all of you for joining us. Have a good night.
Good night.
Thank you.